So I next have the pleasure of introducing Jeff, who is coming up here now. Let me tell you a little bit about him. He is the Managing Director at the Primary Market Research Practice Lead of Centrac, a division of Veris. He was previously founder of Centrac DC, a boutique research firm founded in 1997, specializing in the development and deployment of emerging market research techniques. He has over 30 years experience in market research, and he's been everywhere from P&G to Florida National Bank. In fact, in his role at P&G, I'm told, he assisted in literally writing the book used to train all P&G market research managers. So he also is sort of a hometown boy in the sense that he is back to his old stomping grounds. I understand when he was at Wharton, he actually did a part-time job here at WHYY. So welcome back, Jeff, and take it away.
Gosh, it's bright up here. And how do I forward? Right click. Left click?
On the right.
There we go. It's the one with your thumb on the left, yeah. I will say WHYY actually taught me sort of about phone scripting and making sure that there was a path for everything. It came in useful in market research. So at IIeX North America for the last couple of years, I've had Abby's job as a track chair, and so I've sort of learned, I've watched people in figuring out how to deliver a 45-minute topic in 15 minutes. And it means I have to begin with, and so, ladies and gentlemen, in conclusion. So that's why I threw this slide up first. There's contact information, and for those of you who find this particularly relevant, there's all sorts of ways to get in contact with me to get more depth on this than we'll get into today. But here's what we're going to try and do in 14 minutes today. We're going to talk about the business challenge, the traditional approach, mock committees, what they are, who's involved in them, why they work, how to use them to influence decisions, what actions you can take on them, and possibly, if I'm really fast, I might even get to how they flow. So they were born in value analysis committees, and value analysis committee is typically what's found in a hospital for the stuff that isn't pharmaceutical. But I'm here to tell you that this technique will work for P&T and any other B2B, healthcare or not, type of a purchase where there's multiple stakeholders and decision makers. So in a healthcare context, one of the ways where this could apply is, let's say you're a large insurance company, and you're trying to get Lockheed Martin to now carry Blue Cross in addition to Aetna and Cigna. There's no way that that decision is made by an individual person. So we need a technique that enables us to actually study how that type of a dynamic actually occurs. In healthcare, something like electronic health records, vendors, or any sort of healthcare IT systems that are used on the operations side. These are not things where there's going to be an individual making a decision. And as we know, I came out of consumer packaged goods at P&G. So much of market research was oriented towards capturing somebody at a grocery store who was making a snap decision at one quick point in time. So the business challenge is in a hospital, you have multiple stakeholders. You have the surgeons and the physicians, you have nurses, you have administration, you have finance, and we'd like to think, gee, they all work for the same hospital, but anybody who's worked in this space knows that oftentimes they come to the table with multiple agendas. So the traditional approach, and there's kind of been a traditional qual approach and a traditional quant approach, and in 30 seconds, I'm going to try and describe where the limitations of each of these are. On the traditional qual approach, is people would try and conduct individual cells of studies with each of the stakeholders. So if we were talking about an ultrasound machine, there would be a cell of OBGYNs, there'd be a cell of technicians maybe, there'd be a cell of nurses, and purchasing, and in a nutshell, what we found when we did this type of qualitative is that we would talk to the OBGYN, and the OBGYN would say, oh my gosh, purchasing rules the roost. All they care about is price. I have no influence here. Then we would talk to the purchasing agent, and the purchasing agent, of course, would say, now the first thing I have to tell you is I'm not a medical professional. So I pretty much have to rely completely on the OBGYN. That's how things work here. And you can see instantly that that sort of a dynamic did not produce useful insights from the research. On the quantitative side, what folks tried to do is they'd do separate cells, and then they'd try to apply weighting, W-E-I-G-H-T-I-N-G. Not that W-A-I-T-I-N-G would do any more good. Problem with this is twofold. First of all, there's not a great quantitative basis to do this weighting. And so what would happen is people would try and weight to the universe sizes. But there might be a lot more technicians than OBGYNs. So that kind of a weighting scheme doesn't necessarily make a whole lot of sense. Furthermore, and even more importantly, in the real world, that does not parallel how the decision gets made, because the decision is made by a committee. So what a mock committee attempts to do is we get all stakeholder groups around one single table. And we might go to a highly dense geography, for example, Philadelphia, or Atlanta, or Chicago, somewhere where we can go and we can get a couple of each of these types of folks from different hospitals so that we're not getting everybody from the same hospital and getting the kind of dynamic that we don't want in one of these groups. And we try and recreate the committee meeting. One of the reasons that these things are so helpful on the device side is that normally the device manufacturer's representative is not invited to the value analysis committee. So it's also an opportunity to sort of simulate what might actually go on. And so it consists of training the champion. So that's the manufacturer or whatever the business is, training who's actually going to deliver the pitch to the committee, watching the pitch to the committee, simulating the committee meeting and having the discussion, having them attempt to reach a decision, and then debriefing, hey, what did we just see? Who's involved? Two of these, two of these, two of those. Depends on how many different stakeholders and you know, how in-depth the particular topic is for any particular committee. One of the key ways that these things work is through the use of projective techniques. Probably everybody here has had some experience with projective techniques in other contexts. In this particular context, one of the things that it does is it gets the discussion out on the table. And this is particularly important in categories where there isn't actually a formal committee. So if we're actually doing an ultrasound machine, I think an ultrasound machine goes for $350,000, $450,000, something like that. That's a big enough decision that, believe me, there'll be a committee at the hospital for ultrasound. But for something like tongue depressors or bandages, there won't actually be, you can't actually go to the committee meeting because there won't be a committee meeting for something like that. And those types of dynamics actually every bit as importantly benefit from a technique like this, because using the projective techniques, what we can do is we can generate the discussion that never happens. Because if you've got the different stakeholders with different angles, so the doctor wants one thing, purchasing wants something else, finance wants something else, administration wants something else. If you're going to sell more effectively and improve things, what we've got to do is we've actually got to simulate that discussion, and these projective techniques will get that discussion out there. The other thing that the projective techniques do really well is the depersonalization. So in the Cual example I described before, we're talking about where the OBGYN says, oh my gosh, the purchasing person, they've been here 20 years, they think they own the place, I can't talk to them, I can't do anything. So with the projective technique, we tell them that they now work for St. Elsewhere. Or the people who giggled are giving away their age, right? I always liked it because there was a character in St. Elsewhere who was always referencing his time at the University of Pennsylvania, which is my alma mater. So we tell them that they work for St. Elsewhere or the equivalent, and that although St. Elsewhere has a similar patient profile and belongs to similar GPOs and what have you to their normal settings so that they can discuss this intelligently, the personalities don't apply. And the other thing that we do here is we turn it into the context of giving advice. So instead of asking about what would we have to do at your hospital to change this product or communicate differently or give you this deal or what have you, how do we motivate you, how do we get over these barriers? Instead of doing that, we put it in the context of you're giving advice to somebody who's going to pitch St. Elsewhere. And it removes all of those obstacles and produces much deeper insight than it does without the projective. And it works particularly well with a lot of the healthcare professionals because many of you probably know that one of the characteristics that led them into that field to begin with is that they love to give advice. Particularly somebody like an orthopedic surgeon or a cardiologist, they can't wait to give advice. So if you ask them about themselves, we get these obstacles, oh, can't do it, no way. Ask them about giving advice to a semi-fictional situation, and suddenly we get beyond those barriers and we find we get much deeper insights. So how do you use these to influence business decisions? I mentioned it gets all of the questions and the issues on the table. And obviously one thing that can be done is you can rewrite the pitch, either for the training to the champion or the pitch that the champion actually gives to the committee. Also, oftentimes I describe this as the equivalent of not putting on a Broadway play without a dress rehearsal, right? If you're trying to get props or something like that on and off stage, you want to see that actually happen before you realize, oh, this won't work or that won't work. I also like the sports analogy. I'm from Washington. You might imagine I'm a Redskins fan, but here in Philadelphia, think about if the Eagles were going to try a fake field goal. You're not going to, even Chip Kelly won't be the first one to trot that out on Sunday. Sometime during the week, they're going to test, well, what happens if the holder throws? What happens if the holder runs? What if he goes right? What if he goes left? What if somebody pulls? So a big part of these things is all about the chance to do it in practice before you have to do it in front of the actual committee, where a lot of the folks that we work with tell me that if they don't win the business in that committee, that it's probably 5 years before they get another shot. So what do you do with the results from this? Well, obviously you could alter the product if that's what the insight comes out of it. It can be used to inform pricing. You can develop or refine your marketing materials. I already mentioned that you can refine the sales rep training. The sales rep is basically the one who's training the champion to actually give the pitch, since the sales rep doesn't even have a seat at the table. And you can develop and refine your overall communications. So I guess I actually managed to get to how do they flow. Like a lot of qualitative, you just start with warm-up and background. Before we bias with what we're going to talk about in terms of our pitch, try and get a little bit of understanding about current practices. But then it's all about giving the sales pitch and training the champion, debriefing the sales pitch, running the actual pitch of the committee, letting them actually go into battle, so to speak, debriefing what it is that you see, and then debriefing the whole exercise. So somehow, I managed to add 1 minute to Q&A if you want to.
Well, that gives us 6. It also maybe lets me buy back a minute, keep us on track. So first of all, thank you. Super interesting, and I'm opening up to questions.
So one experience that I've had with these kinds of research is that if you go to a big city, even like New York, you'll get people who are actually competitors in terms of their health systems, and they begin to posture then and not give real answers. What techniques have you used to overcome that?
Well, the projective technique that I mentioned goes a long way towards helping that, because now what you do is you're saying, look, you've just been hired by St. Elsewhere. You no longer work at XYZ, and your competitor no longer works at ABC. You're on an advisory committee that's now talking about St. Elsewhere. And so we're not asking them, what would you do at XYZ? We're asking them, if you were advising somebody else, what would you advise them to do there? And we found that goes a long way towards breaking down those barriers. And of course, the other thing is that we limit these things to typically like 2 each. So in an ultrasound example, we might have 2 OBGYNs, 2 technicians, 2 purchasing agents. And oftentimes, if we do it that way, even in an area like New York or Philadelphia, those are big enough that we would reduce the chances that there's 2 people in the room where both of them used to work at the same hospital, and one of them left to go for the other one, and they see themselves as prime competitors. So,
hey Jeff, first of all, really interesting presentation.
Thank you.
So I'm thinking through this the next stage here. So you do one of these, there's these mock pitch sessions the whole bit, and let's say it doesn't go that well, right? Is there an agile iterative process where you debrief from the situation, and maybe there's an opportunity to do a second one?
Yeah, like a lot of qualitative, I want to say never have I gone into these things planning to do one. First of all, you don't want to do one, like any piece of qualitative, that if you only did one, how would you even know if you got the weirdos, right? Like what if that was really the weirdo, that those were the only people that thought that? Secondly, oftentimes we go into it planning multiple pitches, and depending on how complex the category is and how complex your pitch is, so say for example an ultrasound machine, we probably don't have time, and these groups tend to be longer than a typical focus group. We run them anywhere from like 2.5 to 3.5 hours, I would say, on average. But even in that amount of time, we're probably not planning to go in with fake field goal left and fake field goal right. That it's one pitch in one group, and we're going to go and do a second group in that city, and we're going to go 2 more groups in another city because somebody thinks the geography has an impact in such and such. So the time that it takes to actually simulate one of these things makes it difficult to do more than one thing at a time. So, if a project is 3 cities, 2 groups each, we try not to do those like on consecutive days, beyond that it's tiring. Right? But that would definitely give you the opportunity to iterate, that you take the learnings from the first group, and that can definitely impact what you do in the next sessions.
One more short one.
Wow, 2 mics. Not that quiet. Yeah, I was just wondering, I mean, you use this process to understand the buying process when there's, a discrete, cohesive purchasing group. What about treatment decisions where there's a committee of sorts going on? I mean, you have the physician and patient at the center. And then maybe on the periphery, you have payers, caregivers, other folks. It is sort of a decision by committee sometimes. Is there any way to apply this process to something a little messy like that?
Yes, and I mentioned earlier that I actually think that that is every bit as valuable and sometimes more valuable because you really have no other choice, I think, in those situations. The traditional is you interview each of those folks separately, and then you never understand what the conversation is or could be, because lots of times, independent of market research, those conversations that you're talking about, those aren't happening. And so the research technique, even though there is no formal committee in an example like that, projectively, we can put them into that context. Acting upon it is a little more challenging and requires some creativity, but that's, in my opinion, better than the alternatives.